Good afternoon, wonderful audience. It's my pleasure to be here. I'm from Beth Israel Deaconess Medical Center, and we have an imaging lab. And imaging lab tries to take care of different image processing tasks. So our major area of interest would be anything which includes any kind of image analysis and processing and post-processing or image enhancement in particular. But today I'm going to talk about a very specific task, CT dose reduction. As we all realize, high radiation dose is not something beneficial for our patients, so we would like to reduce it. There are different approaches to that. Basically, and there are two paradigms. One is vendor-specific, when vendors try to introduce some techniques on their scanners to post-process raw data from the scanners. It probably gives the best results, but they are vendor-specific. So in multi-vendor clinical environment, you cannot really rely on that. And the second one, which we try to work on, is vendor-independent, basically taking CT image from whatever scanner with low dose and trying to enhance post-process the image in such a way that its quality starts approaching the high-dose CT quality, which basically means reducing a lot of noise, which is so typical for low-dose CT scans. And that's what we primarily do. And to do that, we developed nonlinear filters. We basically started with something which is known as bilateral filters, but we did a lot of mathematical and parametrical enhancements and dedicated basically a lot of time trying to tweak the parameters in those filters to produce optimal results. So what I would like to show you here is an example of our experiments and studies. In left top corner, you see the original low dose image. Then just under it in left bottom corner, you see an example of vendor-specific denoising. In this particular case, the G filter, scanner side filter. In right bottom corner, you see the result of our filter. And in right top corner, you see the high dose original. So basically, as you can compare and see, the quality of our image in the right bottom corner is quite comparable with the quality of the high dose image in the right top corner. So it's very much same quality. So that's basically an example of what we do. We did implement it clinically. And we did put a lot of effort actually to do it real time. So it runs with what we call real-time speed, approximately 5 images per second on average CT. But we kind of beefed up our CTs and we use them right now clinically. So what happens, our scanners scan patients at low dose, then it gets it's filtered in real time by this particular technique, and that's how it's saved into packs. And again, it's vendor independent, real time, and saves currently roughly 30% of radiation dose. That's it. Thank you very much. Great.